This is a difficult question. Hi, I'm Dr. Ron Rigby. Like I said, eating disorders are a very difficult type of issue. There's lots of factors that can be playing a role with this. So first of all, if you feel like you have an eating disorder, bring it up with your provider. And if they brush it off, keep bringing it up. Maybe even looking to seeing a therapist. But keeping in mind, not all therapists are trained with this. So maybe we need to look into a therapist that deals with more with eating disorders. But in general, there's multiple different types of eating disorders. So it's kind of like saying, how do I get over headaches? Depends on the cause of the headache. So keep that in mind, is what's the underlying cause of the eating disorders? We need to bring it up. We need to discuss it, be it with me, somebody else in my clinic, your provider, whoever it is. Be an advocate for yourself. Keep digging in. But I'm going to deal into one of the more common ones and how I look at it, binge eating disorder, which is feel like you're out of control eating faster than normal, eat to the point where you feel like you don't always have to throw up, but almost feel like you're going to throw up. But if you're noticing you're doing some of this, a couple things. One, what's the situation that you're now noticing you're in? If it's right before your menstrual cycle, go look at my other posts about what to do about cravings around your menstrual cycle. But if it's not around that time, is it stress related? Unfortunately, a lot of times we're trying to look for a trigger. There doesn't have to be a trigger, but we look for that just because if there is a trigger, we want to address the trigger before we do more than that. But if there is a trigger, let's talk about it. If there's not a trigger, if it's a couple times a month, if it's a couple times a week, getting a lot more concerned. If it's on a daily basis, also another concern. In my experience, a lot of times when you're having this, when you want to eat more, it's more of a certain type of food, not any type of food. Most people aren't having this craving or this desire to go eat more protein. Bacon, eggs, steak, fish, beans. Most people can't wait to go have a little bit more healthier fats, be it olive oil, coconut oil, avocado oil. Nobody's doing that. Most people aren't like they're out of control when they're eating a green leafy salad, spinach, broccoli, cauliflower, all the vegetables above the ground. Odds are you might a little bit more with the potatoes, and it has a little bit more sugar. Sometimes a little bit with carrots, again, a little bit more sugar. Sometimes with fruit, sometimes with grains. But a lot of times it becomes a lot more of an issue with more of the processed food. Most of the stuff that's in the middle of the grocery store comes in bags and boxes and has a bunch of barcodes on it. On the ingredients has a big long words that you can't pronounce that even scientists that don't deal with it probably don't understand. Your body doesn't know how to deal with these things either. So how do we do this? That's where my first recommendation is when you're feeling like you need to eat is I always recommend starting with protein and healthier fats. Why? Because we're trying to put the essential stuff in first. Second, if you're going to eat something, eat carbohydrates, but start with the vegetables above the ground. Odds are when you're overeating, you're probably doing more of the processed food. That's the difficult part because we have this urge to eat, but you're not eating real foods. You're eating what I call man-made or food-like products. We're trying to eat more real food, not food-like products. So again, when you're having those urges, try to have protein, fat, vegetables. And if you do have some of the food-like products, try to start small. Try to have a little bit. Try to walk away. A lot of times if you walk away and get busy, those cravings go away. See the trends, but what are the types of foods, keyword types of foods or food-like products as I call them, that you're triggering? Try not to have them around. Don't bring them in the house. Don't go find them in the grocery store. So it makes it harder to get. Some people will do a lot more on fast food. Fast food has a lot of chemicals and different components with it also, food-like products. Again, skipping it one time isn't going to solve the problem. This is a healing process. Elevated insulin, which comes from more food-like products or carbohydrates, can trigger more inflammation. Inflammation in the brain can now allow how the neurotransmitters communicate not to get the signal. Therefore, you might not get the signal to say I'm full. Therefore, you want to eat more. Again, could that be part of this whole process of why you eat more is because you're not getting the signal that you were taught to look for by doctors and your mom, eat till you're full. That's where some of these factors can play a role. Medications can help. But again, keep in mind medications are a tool, not a solution. We need to attack this from multiple different angles. Reach out to us. Getting it from people who deal with the problem, who have overcome the problem, might be better than somebody just giving recommendations. Recommendations are one thing. Somebody who's struggled with it's a totally different aspect. That's what's gotten me into this aspect of the medical field is I struggle with some of the metabolic health issues. I'm trying to fix myself also. Attack it from that angle. And it's hard to deal with. Not a quick, easy answer, but it's solvable. We can heal it. Give yourself credit. Keep trying. Reach out for help. If you have some of these underlying eating disorders, or if you feel like you're struggling with them, reach out to us or to somebody you know, or to your doctor, or to a therapist to get some help. This is a healing process.